Today we're welcoming Dr. Alex Hilario to the show today. How you doing, man?
Good. How's it going?
I'm doing great. I'm really excited about this. I think you got a great story, great information to get out there. So I'm curious to hear from you. How did you get in the wellness place, and how are you helping people today with your story?
For me, I was a pre-med student in undergrad, and I was looking at different types of professions, medical doctors, psychiatrists, dentists, podiatrists, and shadowing different types of doctors. And I was got to the point where I shadowed a chiropractor, and I really enjoyed what he was doing, the results he was getting, and doing around the same time, I was also moving out of my apartment. I was supposed to get some help. I didn't get the help that I was expecting. I ended up, lifting some heavy couch and herniating a disc in my back, and then I had, sharp shooting pain down my leg, and I went to see the chiropractor and treated it with chiropractic care and got some great results. So I decided to kind of stick with that. Been doing it for about 21 years now, and I've had the privilege of helping people and seeing a lot of people get better with a treatment that has no real side effects, no lasting side effects, and great results.
Awesome to hear, man. So you had this injury with your disc in your back. You got well, and now you open up your own practice. Is that right?
That's right. Yeah, I've been doing this for about 21 years, and um, I've been in the current town where I'm at for about 10 years, and I've been able to help a lot of people.
Awesome. You want to talk a little bit about that and your practice and how you treat people?
Yeah, so there are a number of different techniques that chiropractors use. Um, so, we're not treating patients all the same, but they're very similar. Diversified is a technique where we use our hands to restore motion to the spine, kind of get that pressure off of your nervous system as well as your discs. We use different techniques to balance out the muscles, to take that tightness off of the muscles, stretching, strengthening exercises also. So there's a number of tools that we use, decompression. But the idea is to restore motion to the spine. So you have your nervous system, which controls everything. It's the first organ that forms, and it's the only organ that's completely covered by bone, from your skull through your spine. So it's very, very important. And restoring motion and getting pressure off of your nervous system can help improve other aspects of your health. There's people sometimes that are dealing with digestive issues or reproductive issues, and they, report that those issues were cleared up after getting chiropractic care. It's not something that we go around saying that we treat because we don't specifically treat those conditions, but sometimes patients, because the nerves that were going to these organs were being pinched, were experiencing dysfunction in those organs.
Awesome, man. So I understand that we have different types of nervous systems. Is that right?
Yeah.
You want to go into that, kind of like a little bit of science behind what the nervous system is?
Yeah, I mean, it's the part of the body that sends information to all the organs and all the cells really in your body, and it's broken down to two parts: your sympathetic, parasympathetic nervous system, and some of them are in charge mostly with your flight or flight. Depending on your what you're dealing with, stress, overcoming an attack or something to that nature. And then there's a part of the nervous system that's just controlling your day-to-day stuff, your digestive system, your reproductive system, the things we're not thinking about. So, again, your nervous system controls everything. And there was actually a pathologist who studied over 200 cadavers, and he found that whenever there was a pinched nerve, there was organ damage. So, you may have a pinched nerve in your body and not experience any symptoms, but then have issues where your organ is not functioning the way it's supposed to function and have damage to that organ.
That makes sense. It's called the autonomic nervous system. Is that right?
Mm-hmm. Yep.
And we have like the central nervous system and the peripheral nervous system. Uh,
Yeah.
do I have that right?
Yep. Yep. So your peripheral nervous system is kind of like the nerves that go off of the spinal cord and into your arms, your legs. And sometimes if they're being compressed, depending on what that nerve does, you could feel tingling, numbness, or shooting pain. But there's nerves that are not expressing pain, so they just send information to the organ, and that could be compressed also.
Got it. And you use a variety of tools in your practice, right? Like acupuncture and decompression. So you have like a variety of things that you do to help people. Is that right?
Yeah, we try to integrate as many tools as we can, just to have those options there: activator, decompression. We also work with acupuncturists, and even medical staff, to make sure that we have all the options available to give the patients the best results.
Awesome. What do you find in terms of effectiveness with the tools?
Pretty effective. I mean, I yet to see a patient that's not responding to care. Sometimes there are issues that need to be referred out, but in terms of your musculoskeletal issues, and even getting the miracle um, results with other issues, we see that too.
Awesome. And like you were saying before, like the nervous system is kind of like the foundation of our life. So it's kind of like how we experience the world in a sense. Is that right?
Yeah, yeah.
Yeah. I mean, because if there's something off with the brain or nervous system, it's just kind of like, I mean, that's how we deal with stress as well, like how we perceive life. So it's kind of really important to get that in check and stay healthy.
Yeah, and there could be irritation on your nervous system from imbalances in the muscles, from positioning of the curvature. And then, your emotional stress also affects you physically. So if you notice, when you're under a lot of stress, you get pain in the shoulders and your neck and your upper back, sometimes your low back, because it's all interconnected. One affects the other. And then having that normal curvature also affects the central nervous system. So you have your brain and your spinal cord. The spinal cord, when it's stretched, there was a neurosurgeon and a Nobel Prize recipient that found that when you lose that normal curvature in your neck, that also leads to disease. Um, when you have that forward head posture, where your head kind of goes forward, you have the little hump in the upper part of your back, that was found to also increase pressure on the neck. So for every inch of forward head posture, you increase that pressure on the neck by an additional 10 pounds. So that over time can cause disc herniations and pinched nerves there.
Wow. Yeah. What do you see commonly in patients that have the nervous system disrupted? Like, what are some common causes for that you see?
The most common stuff that you'll find is neck and back pain. People come in with those, and then we'll realize that it's not just that. There's pinched nerves, there's sciatica, radiculopathy, other issues, and they're dealing with other issues in their health also.
Right. So, like a lot of like disruptions in the nervous system, like what are some lifestyle things that you think could be contributing to that in a sense?
Posture. We spend a lot of time in office work where we're sitting down, we're on our cell phones looking down, we're on a laptop. Um, it's not the best position for the body. And then we're commuting, we're sitting in a car for an hour, we're commuting on the way back home. And then there's trauma, car accidents, falls, sports injuries. Those things tend to really stress the spine and lead to where you're losing the normal curvature, you're losing the normal movement in the spine, and then that's irritating your nervous system. And then when there's pressure on the nervous system, it's affecting other organs.
That makes sense. So I think like being mindful of our posture throughout the day and our daily activities would be an important thing as well. Is that right?
Absolutely, yeah. Ideally, when it comes to posture, you want to use a desktop if you're spending a lot of time in front of a computer. So where you're looking straight ahead at the monitor, your keyboard is low, so you're not shrugging your shoulders. You have back support. Your feet are flat on the floor. So your posture makes a big difference. And then you want to get up every hour if you can, stretch, move around, get the circulation going.
Yeah, just like basic ergonomics, right? Just being able to have certain things set up in your work environment so you have good posture, right? Just being aware of it because I feel like a lot of people just don't pay attention to it. They're not aware, and over time they develop these spinal issues, joint issues, just by being in the wrong position for how many ever hours a day, right?
That's right. That's right. And it's micro trauma, right? So it's not like you had a car accident, you develop these issues. Like they come out of nowhere. You wake up with neck pain, you start feeling back pain when you get up off the sofa, or after you commute home and you start asking yourself, what is this? Oh, it must be age. Well, it's not age. You're putting your body through these episodes of micro trauma where you're stressing the tissue beyond its limits, just by piling up all these hours. And then that leads to disc bulges, herniations, pinched nerves, arthritis, a number of different conditions that can affect your health.
Absolutely. Like if people are experiencing pain, for example, like a lot of times I'll hear it just like I have a bad back or I just have a bad knee or whatever, and it's these movement inputs that we're having throughout the day that are a big contributor. That's what it sounds like, and I feel like awareness is the first step, right? And it's like it's not how it has to be. Like things can change based off what we do, and of course, seeing people like you is always a great idea as well. So, do you have anything to say on that?
Yeah, I mean, again, a lot of people will kind of chuck it off to being age, but it's not, because you'll see people in their 80s and 90s who are, lifting heavy and doing crazy things, and you're like, how are they doing that? Like I'm in my 30s and I'm dealing with pain. Um, but it's what, you're putting your body through and not realizing that you're doing this and you're stressing your tissues beyond their limits. Sitting a long time. Again, if something is kind of creeping up out of nowhere, you kind of wake up with pain, that's an indication that there's been, micro trauma and structural issues in your spine or your muscles that have been accumulating, and now you're experiencing pain because now it's irritating, your pain sensitive nerves, right? So usually there's a dysfunction, then there's a pain. So when you're treating it, you get rid of the pain and then you get rid of the cause of the pain, which is what chiropractors tend to focus on. Not just eliminating pain, because you could do that by, going to your pharmacy and getting some painkillers, but correcting the cause of the problem so that the pain doesn't keep coming back and doesn't progress where you're developing arthritis or, a herniation or, you know, permanent damage to the peripheral nerves.
That makes sense because if we have an issue, we don't want to let it to become chronic, right? It's kind of like important to deal with it, um, like in the moment, in a sense, or as quick as we possibly can, right?
Absolutely.
Yeah,
Absolutely.
because like a lot of this chronic pain that we have, it's due to chronic habits in a sense. So just again, like just being aware of that and trying to avoid that chronic pain because it can be so debilitating, man. Just trying to live your life and just being in pain. It is difficult, and I'm sure you see that a lot as well.
Yeah, and we're in a culture where we're super busy and doing a lot, and we want everything quickly, and we kind of just ignore these symptoms. If we can manage the pain, if it's a 3 out of 10, you're like, I could deal with this for now. But the longer you wait, the more complicated it gets. So the sooner you address it, the better your chances of correcting it and eliminating the symptoms, so it doesn't keep coming back. And with chronic issues, your body adapts to that, right? Could even get to the point where your bones are growing out and even fusing together. So once you reach that point where the bones have fused, you can't restore motion, and that joint is always going to be an issue.
Really?
Yeah, so it can get bad. It takes time. It takes 15 years to get to the point where your bones have fused, but it is something that happens. You'll see older people. It's like their bones are fused and they have severe arthritis. It's mostly because these symptoms have been ignored.
Yeah, just like you just said, like our body kind of adapts to these movement patterns, but it's kind of a maladaptation, right? It's not something that's ideal, but your body's doing whatever it can to kind
Yeah.
of like keep its structure, you know, like keep posture and all that. But it's kind of like diabetes in a sense. Like uh, you have all this sugar coming in, and your body does its best to manage it
That's right.
via insulin resistance. Like your body is developing a mechanism to kind of safeguard all this influx of sugar. So it's trying to help you in a sense.
Yeah,
But that's great. I mean, we can do that because we're so resilient. But the key is actually to remove the root cause.
that's right. Absolutely, completely agree. Your bones grow out to try to protect that area because there's instability, because there's inflammation. So you definitely want to address that because it can get to the point where your body's adapting to kind of help you manage, but then it creates bigger issues later.
Yeah. Uh, the term is mechanotransduction, I believe. Is that right?
Yeah.
Yeah, mechanical transduction. Essentially, the loads that we have in our body on a day-to-day basis, just whether it's too much sitting, maybe we're just too stagnant throughout our day. Maybe it's, maybe our bed is just kind of old. Just all these things to think about. Posture throughout the day, and you will feel better once you start to just make small adjustments to your routine. It's I mean, how long do you think it usually takes to like see improvements from that?
When it comes to chiropractic care, or just changing your posture and
Um, I'd say both, but primarily just the posture change throughout the day.
yeah, so there's a number of things that you want to do, and the sooner you start doing them, the better you're going to feel. So again, we talked a little bit about your posture when it comes to sitting in front of a computer. When it comes to your bed or your mattress, you want to replace it every 5 years. When it comes to your posture when you're sleeping, ideally you should be on your back. Your ears should be aligned with your shoulders, so your head shouldn't be going all the way forward with this big pillow. You should have a small pillow where it's supporting your neck. But you'll start feeling, some improvement within the first couple of weeks where you're feeling a little bit better. But sometimes there's joint restrictions within the spine, and that's not going to correct itself. So you want to address that by integrating something like chiropractic care.
That makes sense. So if somebody's in pain, they have an issue, how do they know that they can just do some things on their own? How do they know if they just do some chiropractic care or actually do something medical like surgery? Like,
Yeah.
you want to explain that?
So pain is a sign that something is wrong, and your nervous system is screaming at you, saying, "Hey, we need to address this. This is a priority." So if you pay attention to how your nervous system works, for example, you take a pen and put it under your thigh when you're sitting down. Initially, you realize that the pain is there, and if you leave it there long enough, you forget that the pain is there, and the pressure remains, but your nervous system is prioritizing what it focuses on, right? So you're moving your arms or whatever you're doing, you're writing, and you forgot that the pain is there. We start moving the pen around, and your nervous system's like, oh yeah, we have this pressure here. So when you're experiencing pain, that's your nervous system saying, hey, we've been dealing with this long enough, we need you to do something about this. So at that point, I would definitely start seeing somebody right away. So your chiropractor, your physical therapist, your acupuncturist, your massage therapist, I would start there where it's like benign treatment where it doesn't have, side effects. You can see your general medical doctor as well, to follow up, to look into, your blood work, your urine, x-rays, whatever they want to kind of dig into. But you want to find out what's causing this pain, and addressing it with these types of treatment that are not going to have any side effects. With surgery, it's a little bit different. Sometimes it's necessary. I've had a few myself, but that should be the last thing that you're running to. You should have tried everything else before surgery.
Got it. So it sounds like it's important to have an order of operations.
Yeah,
The more natural, the better,
yeah,
right?
yeah. So when it comes to surgery, a lot of times you get good results, but a lot of times, you don't. It's like 50-50, and you have to live with whatever the results you get. So you definitely want to try, your more passive treatments before you get to something that aggressive.
Yeah, I mean, especially like in the medical world, we just kind of like treat so many things as an emergency and not actually understanding that, sometimes we just need a more gentle approach to healing. It's
Absolutely.
like our body is designed to heal. It wants to heal. It doesn't always need to be forced, right? Unless you have an absolute like emergency, your body can heal itself most of the time, I find.
Yeah, absolutely. Yeah, the power that created the body has the ability to heal itself. If you
Absolutely.
remove that interference, your body can do incredible things, and we are super resilient. And your body will adapt to things too. So strengthening, having good nutrition, those things are huge.
100%. Like our body expects us to do certain things, like certain habits. Like it's designed to be healthy. Most of the time, I find we just need to get out of the way and let us do what it's designed to do, which is to stay healthy and heal itself.
Yeah.
Yeah, like you talked about nutrition, like all these inputs that um, when we have them together, there's like a synergy that kind of makes you unstoppable in a sense.
Yeah, absolutely. Absolutely. Yeah. So, integrating those, you start with walking, start with making small changes to your diet, and, just keep building on that. It could be life changing. Integrating things like chiropractic, acupuncture, you know, um, physical therapy, personal trainers, even if you you don't know what to do, where to start. But yeah, those things can make a huge difference in your health and how you feel, as you age also.
Yeah, man. Like you talk about like a mind, body, spirit approach. Like
Hmm.
that's important to have because we don't want to really neglect anything because, like you said, everything is connected in a sense, and just being able to have these pieces and just make progress. It's not about perfection, but just
Yeah,
taking that small steps every single day and keep on adding. Like these habits stack over time, and then you just see your health like flourish in a sense.
absolutely. Yeah.
Yeah. Uh, Out of curiosity, what's your approach to nutrition?
I think you should just kind of eat what God made.
Yeah.
Your fruits, your vegetables, meats, and kind of avoid the stuff that's processed and that man kind of puts his hand into too much. And that generally works well. Stick to the stuff that's the least processed, and I think that makes a big difference in your health.
Yeah, just so it sounds like eating real food, not things that are highly processed that are made in the lab last week, right? Just
That's
kind
right.
of like things that your body would recognize as real, things that our ancestors have had for,
Yeah.
forever. And yeah, there's so many things can go into that, like organic, uh, just joining with the thing you want to expand on within that.
Yeah, I mean, I personally try to avoid the stuff that's been tampered with too much. Your organic, your grass-fed meats, your eggs, and your vegetables and your fruits, and kind of stick to that most of the time. It's a birthday party. You want to have a piece of cake, by all means. Don't you know not enjoy that stuff, but it should be rare. It shouldn't be all the time. And you want to avoid your processed foods, your fast foods, because it's not real food. It's stuff that's made and processed and just unhealthy.
Yeah, 100%. I mean, I don't know about you, but my philosophy when it comes to like pleasure is kind of like I don't recommend having any type of highly processed food that's going to blatantly hurt you. But at the same time, I'm not the guy who's going to tell you not to do it, because, people are going to do their thing and that's all good. I'm kind of more so if you want to have like a cupcake, do it out of real food ingredients every now and then. So real cacao, real blueberries, like maybe almond flour. And I feel like it tastes even better, just like
Yeah, yeah.
and instead of just eating like a hostess cupcake, right? It's kind of like, and for me, it goes a lot deeper than that because like beyond the health, it's like the energy that's going into it. These people don't necessarily do this for your health. They're kind of doing it as like a business model. Like, and they're having scientists that literally make you addicted to their product. They
Yeah.
do all these things like gas chromatographs, like it's insane. So I just don't want to be around the energy.
It's crazy too. And one thing you may notice too is that when you give it up for a significant amount of time and then you try to reintroduce it, it tastes disgusting. Like, I personally used to like eat fried foods, and then, I got rid of that out of my diet. And, sometimes I'm with my daughter and she'll be like, oh, let me get some, mozzarella sticks or some chicken tenders, and I'll have a bite. And I just like all that grease in your mouth is just like, so your taste buds adapt to this too, where it's like, no, we don't want that anymore. That's actually kind
Yeah, that's a real thing. Your taste buds
of,
really do adapt,
yeah,
and they're no longer hijacked by this processed food because nutrition, like flavor, is supposed to be an indication of nutrients, right?
yeah. Hmm.
But we have scientists that kind of mimic these flavor sensations, so you get the calories without the nutrition, and it's kind of like messing everyone up.
Yeah, yeah. So yeah, one, a good approach is to do a little bit, at a time. Make some small changes. I think people that make drastic changes to their diet or to their exercise, where they're, doing too much too quickly, um, tend to give up faster. But if you're making small changes, you're like, okay, I'm going to give up, bread. I'm going to give up sugar. I'm going to, and little by little add to that. I think you can make some lifelong changes that are manageable.
That makes a lot of sense. Like just being able to have grace with yourself in a sense, like
Yeah,
not doing everything at once, and
absolutely.
being able to make these small changes every single day. I mean, that's how health is really. That's how it happens. It happens over time, and I feel like the cold turkey approach may be too much for a lot of people.
Absolutely, yeah. And same thing with exercise. Start walking if you're not in a condition to start lifting, or running. Start walking. Add some minutes to your walks. And some light jogging, and then little by little it becomes a routine. And you're like, wait, I didn't get to do my walk today, and it's part of your routine. We're creatures of habit, so adding a little bit every day makes a big difference over time.
Yeah, we discussed this a little bit, but you talked about healing pain naturally, like without medication. Uh, so, of course, like the posture and all that. But is there anything you want to expand on within that?
Um, the curvature in the spine, and the movement of the spine makes a big difference. Again, your nervous system controls everything. So there's people out there who are dealing with digestive issues, other issues in their health, and they may not think of the spine as, where we should be looking to, but sometimes that makes a world of difference. So if you've never tried chiropractic care, look up your local chiropractors and see what the reviews are like, and go visit them, and that can make a
Yeah.
big difference in your health. There was a study in the Mayo Clinic that found that forward head posture leads to disc herniations and arthritis as well as pinched nerves. So, there's a ton of research that supports integrating chiropractic care. So, integrate that. Start walking, start doing some exercises, make better choices with your food. Like one of the things I say to my kids is like, do you even remember what you ate? And it's like, we don't, so use food as fuel, not as just kind of, you know, feeding our taste buds, because it over time it plays a big role in our health.
Yeah, I mean, so is there something that we should do when it comes to looking for a chiropractor? Like, is there a process that you recommend? Is there's different types that for different people?
Yeah, I mean, there are different types of chiropractors who use different techniques. We try to use as many as we can in our office. I've treated infants, I've treated people with osteoporosis, I've treated patients with cancer. We don't treat those things per se, but you can have gentle chiropractic care, even on patients who have osteoporosis, for example. So, not all of it is like aggressive cracking and like jumping on your back. So I don't know, a lot of videos out there, so people make assumptions about what chiropractors do, but we can offer gentle mobilization and stretching to help restore motion to the spine without being super aggressive, and some people need more aggressive adjustments. But I think one good way to kind of um, determine where to go is to look at the reviews, see what people in that area say about that chiropractor.
That makes sense. Like, and if someone doesn't work for you, that's all good. You know, they're like, yeah, you have many options, I'm sure, and just kind of find someone that works for you to help spinal health, recovery, and all these types of things. That's important as well. Um, and maybe kind of change it up over time. Like you said, there's different techniques out there. You may need something right now that you may not need in the future, and maybe you may need something in the future you don't need now, right? So just kind of listen to your body and changing the approach.
Yeah, and it's important, I think, to integrate because, we like taking, pills for everything. It's kind of like the our Western medical model, but we're also, running to the pharmacy and just taking over the counter stuff. And there was a study that found that there's over 100,000 hospitalizations and over 16,000 deaths every year from long-term use of NSAIDs and prescription drugs. So you don't want to just use that to manage your symptoms and kind of keep it moving. You want to figure out what's causing these headaches, what's causing this neck pain, what's causing this back pain. Um, because you can potentially just go to the pharmacy every week or every month and, you know, keep treating it for years and then have significant gastrointestinal issues that can even potentially lead to death. So, um, you know, look for the cause of the problem, and chiropractic care is a good place to start.
Absolutely. Another thing you talk about is kind of living this purpose-driven life that you've kind of developed after overcoming your story and your pain. You want to talk about that a little bit?
Yeah, I mean, and then integrating chiropractic care.
I just cut out for a second. It just cut out for about a minute there. As soon as like I asked the question.
Yeah. So yeah, just taking care of your health in general. Your posture, your your um, your sleep, exercise, nutrition is very important because there's people that are watching you. Also, me myself as a father, I want to make sure that I'm an example to my children. So um, definitely be intentional about your health. And you get one body, so you have to deal with whatever you're doing to it now. You'll have to deal with that later.
Absolutely, man. Like living a purpose-driven life. I mean, it's so important because like, why do you want to be healthy in the first place, right? It's actually to live the life that you're meant for, and staying on track with your purpose is so key.
Yeah, and quality of life. As we get older, you want to have good quality of life. You don't want to be completely dependent on treatments.
Absolutely. I mean, because it's hard to live your best life and quality of life if you're in pain all the time. So feeling good is so important. And as human beings, like we're so resilient, we can do things if we're not healthy. Like we can, but how do we stack the conditions in our favor and actually kind of energize our life? Like just kind of like have things happen more gracefully in a sense.
Yeah, yeah, and even seeing your massage therapist and just looking out for yourself.
Yeah. And do you have any recommendations for people? Maybe if they're in a hard place and they just seem kind of stuck, and they need to overcome an obstacle, they need to overcome themselves in a sense, and just they really need to make a breakthrough in their life. Is there anything you recommend?
Well, the first thing is your mindset. You have to believe that it's possible, that it can happen, that you can have a different life, that if you're dealing with obesity, you can break that cycle, and you can get to the point where you're healthy, and you look healthy. So the first thing is to believe, and sometimes we need to talk to people or get a mentor, get a therapist. But when you believe that it can be done, it all starts to kind of fall into place. I can lose the weight. I can make these changes with my diet. I can live a pain-free life. When you start believing those things, the steps follow.
100%, man. I mean, those limiting beliefs that we carry around via experiences, via trauma, whatever it is, like they're holding us back because the beliefs I find precede the actions that we take. Do you find that as well?
Absolutely, absolutely, yeah. Sometimes we go through stuff as children, and we kind of self-medicate with either alcohol, drugs, food, whatever it is, pleasure, and we get stuck in those places. And you know a couple of decades go by, and then we feel like we can't overcome. But if you start believing that you can, you will.
How do we start to shift these beliefs? Like, if because it can be difficult, man. Like, we have a lot of like struggle in our lives. Like, it can be difficult to shift that belief and just be open to possibility in a
Yeah,
sense.
I think information. A lot of people, for example, don't know that chiropractic can help with other issues in your health besides your typical neck and back pain. And sometimes getting a mentor, working with somebody who's accomplished what you want to accomplish. A personal trainer, for example, if it's about your physique or your weight. Working with people who've done it, and starting to adapt their thought process.
I love that. Just finding someone, like you said, is kind of like a who has walked the path that you want to walk. Someone who has done the things you want to do. Because, of course, like listening to people's advice, but if they don't have the same results that you want, I mean, is it really worth like taking what they have to say to heart in a sense? Like
Yeah,
they may mean well, but if just say like your doctor, he's telling you you can't get well from this disease. You can either listen to him or you can find someone who is in alignment with your goals, right? It's not like this person is meaning any harm. He's just doing the best he can with his training, most likely. And essentially knowing that and just staying true to your heart, staying true to your values, and finding someone who can walk that path with you is so key.
yeah, yeah. And sometimes we need to speak to multiple people before we get the answers that we're looking for. But when it comes to pain or health issues, you want to get to the root cause of the problem. You want to keep looking if you haven't found the root cause. you don't just want to treat stuff.
That's a good point. Like sometimes you do need to talk to multiple people. Sometimes it's good to get another opinion as well. Like if you're hit with this terrible thing, maybe you need to talk to someone else and just make sure, because a lot of times mistakes happen. You know, like diagnoses aren't always accurate as well.
Yeah, and we don't know everything, so sometimes we need to get a little bit of information from a number of different people to get, the complete picture of the puzzle.
That's a good point too, because like not everyone knows everything, and just kind of like just staying open to what can be. Because if we close off and say this thing can be done, then like we have this thing in our brain called the RAS, right? The reticular activating system.
Hmm.
And essentially, you know, our brain is going to find the answers that we ask our questions to, whatever it is. It's like
Yeah,
instinctive elaboration. So asking these empowering questions, just like you're saying, man, that's key.
yeah, absolutely.
So I know, like pain management, we talked about chiropractic care and posture and all these types of things. Uh, is there anything that maybe people don't think of that are kind of like a blind spot that could be contributing to it, or potentially they can start to integrate in their life to start healing?
Sleep is another thing. I
Yeah.
think that you know we our younger generation loves to be up all night, and we love to be stuck on our phones too. Everybody's addicted to their phone these days, and you may not be getting the sleep that you need, but that's where your body does most of the healing. So, we should be definitely paying attention to that. We should be disconnecting at least 2 hours before sleep. From your phone, your blue light, your laptops, whatever devices you're using. But that's another big one in terms of healing and um, activities that you can do to kind of decrease inflammation and promote healing.
That makes sense because like sleep, of course, you know, a lot of us don't get a lot of it, and we don't understand like the sleep quality is important as well. Not just getting the amount of sleep, because a lot of people we wake up feeling tired even though we get the right amount of sleep. That's probably because we're not getting the right quality. Do I have that right?
Yeah, that's right.
Is there some simple things that people can start to do today when it comes to improving their sleep quality?
Again, disconnecting early, kind of winding down a couple of hours before you go to bed, and then making sure that you're kind of planning for 8 hours, 9 hours, so that you're falling in that range, um, and giving your body the opportunity to heal.
Yeah. So disconnecting from devices. Um, maybe you watch the news at night. Just you kind of listen to stressful information. So it's kind of like decompressing in a sense. Like we have
That's,
morning routines, but a lot of us we kind of like pass out instead of go to sleep. We don't actually have an evening routine.
yeah.
You know.
And
So
kind of need a routine because we're a little bit more high strung and a little bit more type A.
yeah,
So we wanna kind of create that environment. I personally use like blackout curtains, and
yeah,
I try to disconnect from my device, a couple of hours before, and just wind down. Sometimes, you know, even what you're consuming, before bed makes a difference.
blackout curtains have been the number one thing for me to help improve sleep quality. It makes such a big difference, man, because the melatonin is only produced via complete darkness and consistent schedule. And most people we have like street lights coming in our bedroom.
Yeah,
Yeah, so blackout curtains, um, and like you said, like kind of like disconnecting from fear as well,
yeah,
disconnecting from disempowerment and all these things, because they affect how we sleep. Like we have so much subconscious processes going on, so just keeping what standing guard of the door of our mind in a sense, you
yeah,
know.
absolutely. Yeah,
Yeah, man.
avoiding the drama and all this stuff that gets stressed out before bed.
Yeah. Uh, Another thing is like staying cool at night. Is that
Yep,
right?
yep, absolutely. You want a cool room. You get some better sleep. Showering before bed helps too.
Yeah, like because we go undergo like thermal regulation, right? And it kind of gets colder everywhere you go in the world at night.
Yeah,
So it's like just don't sleep hot because we kind of expect to cool down, and that can definitely disrupt our sleep cycles as well.
Yeah. Great.
So you talked about sleep. That was like a blind spot for pain, right?
Yeah.
Is there anything else that potentially could come to mind for that?
Um, you know, eating a couple hours before bed too, as opposed to eating right before bed. That tends to help. Avoiding caffeine. Um, that's a big one too for people. Even if you're used to consuming a lot of caffeine, sometimes even some late afternoon caffeine can make a difference in your sleeping pattern. So I would avoid that.
Yeah, absolutely. Uh, Something that you have uh, talked about a little bit throughout, but kind of put a cap on it essentially is physical rehabilitation, right? Uh, you want to expand on that and how people can start to think about what that actually means?
Yeah, I mean, sometimes we have weaknesses in our muscles and imbalances in our muscles, and it's important to learn what those are and being able to address those because when there's significant imbalances, that can lead to injury and then re-injuring and then re-injuring again because you're kind of going back to your routines. Whether it's the type of job you do or how you sit and sleep and how you do things. We're creatures of habit, so we'll keep going back to the same thing. And then once you've injured a joint or a part of your body, it remains weaker. So the chances of re-injuring increase. Physical therapy, even chiropractic, a lot of chiropractors do physical rehabilitation where we're addressing the weaknesses, the imbalances, and creating more stability in the joints so that you're not re-injuring.
So having joint stability,
Absolutely, yeah.
awesome.
Yeah, and you have a couple of major joints that are open joints, like your shoulders and your hips, and the muscles around there are extremely important. If not, we'll re-injure those.
Right. Like just addressing the weaknesses that um, we may not have any awareness of what is weak in our bodies. So how do we kind of like assess it?
Yeah, I mean, I would, if you're experiencing any type of pain, shoulder pain, don't ignore it. I would definitely go see somebody. I myself have had shoulder surgery because I was a big power lifter, so I was stressing my joints a little bit more than your average person. But um, you know, strengthening those tendons so that you can handle the physical stresses that you put them through makes a big difference. There are people who lift a lot more than I do and are about similar size as me, and they don't tear their tendons because they've strengthened them enough so that it can handle that physical stress that they put it through.
That makes sense because a lot of us we kind of do movements that we're not qualified to do.
Yeah,
Right. We do this heavy lifting, but we have all these imbalances instead of actually working on the foundation first.
yeah, absolutely. So you definitely want to know if there's and if you're dealing with pain, that's already a sign that your nervous system is yelling at you, hey, we got to take care of this.
Is there like a certain approach that you recommend for people if they're just need to start exercising, but they have all this pain and they don't know where to start? Is there an approach you would take?
Yeah, get evaluated. See your chiropractor, see your physical therapist, and get evaluated. They'll give you that information. Usually fairly quickly and help you address it. And start light. So the bigger issue is too much too soon. So start light. Take your time. Listen to your body. If you're getting pain after your exercise, not just your regular muscle soreness, but pain in the joints, that's an indication that you may be doing you know too much or too heavy. So take your time, slow down, and let your body adapt.
Absolutely. And there's always like basic movements that we can do, like walking, right? I feel like the majority of people are able to do that. And just taking a walk every day can be so beneficial. It helps regulate so many things. And it's like one thing that we're designed to do. Like we can have all these heavy weights, but the thing that we are truly designed to do is walk.
Yeah, absolutely. Yeah, that's huge. When it comes to your health, and it improves digestive, it improves a lot of things, circulation, weight loss. So you could start definitely by walking, and even if you
Absolutely.
a seasoned athlete, walking is good.
And it's so good for the mind, just kind of like relax and kind of de-stress and focus on the goals and the mission, all these things. It's such a empowering practice,
Yeah, absolutely.
and it's the most foundational. Just like we want to get all these fancy things in the gym, but just sticking to the basics and mastering the foundation is usually how things are done. Like in anything, just kind of like staying true to the basics and just mastering that.
Yeah, and there's some simple exercises that can help create stability in the shoulders, the hips, your back, your core, that you could just make part of your warm up, and that'll minimize your chances of injury in the gym or during sports.
Awesome. How do you recommend we start to build some stability within our bodies?
So again, there's some simple exercises like abduction of the hips and internal, external rotation of the shoulder. But if you don't know what that is, I would see a physical therapist or a chiropractor and ask them about, how to create stability in the shoulder or your hips or your back so that you're not injuring yourself. But definitely, get that information and, start doing a little bit more, every day.
That makes sense. Kind of like the progressive overload thing we've been talking about a little bit. Just kind of like these small things that we can do and just improve upon,
Yeah,
and improve upon what we're already doing, and just while keeping the foundational habit, not overdoing it.
yeah.
I mean, that's where growth takes place.
Yeah, absolutely. And listening to your body, if you're feeling some achiness within the joint, you're stressing it a little bit too much. If you feel like your workouts are easy, then add to them. Add some reps or add some weight. Um, but you want to challenge yourself and build upon your previous workouts.
Definitely. And lastly, talk about like uh, business growth. But I want to frame it in the sense like you've overcome your story, you've overcome so many things, and being able to kind of like become the greatest version of us in a sense, and then grow the business because I feel like we grow more to serve more. Do you want to expand on that?
Yeah, I mean, I've gone through a handful of things. I've had shoulder surgery. I've had my disc herniation. I've had a kidney transplant actually, less than 3 months ago. And just surrounding yourself with like-minded people has made a huge difference in my life. We have a great team in my office. Other chiropractors, acupuncturists, staff, managers. Everybody is like-minded, and we're able to help a lot of people and keep things going.
Definitely. Like just being on one accord with people, like people who share the same mission, is so key. Like, I feel want to kind of enroll people in the vision, right? And in order to do that, you like actually need to have a good heart. Like you actually want to be of service and truly help people,
That's right.
and just you know not doing it for the money in a sense. But of course, like it's part of it. But service, I find, is the most important fuel that helps you go when times get hard. Because there will be hard times, but staying true to your mission, staying true to your why, that's where it's at.
Yeah, absolutely. And be a giver. Give information,
Yeah,
give your talents. And that'll help you help other people. And that'll attract other people too. It'll attract the right people.
definitely. Just having this altruistic mindset. If people need help, just be of service. Just being willing to help people, and it can be a variety of ways, like monetarily. It can be, just your time. But ultimately, like we grow more, so we can give more. Meaning that if we take on more things for ourselves, in a sense, like to help us grow our skills, our knowledge, then we have more to actually help.
Absolutely, absolutely. That's
Yeah,
huge. I've done some mission work too in different countries. And the cool thing about chiropractic is I just could bring a portable table and help people. So it's been a blessing for me.
awesome. Other things like if people like they're in that place and they're ready to get started, um, is there some first steps you should recommend for people to actually start to kind of expand and grow that business, or maybe just get started to help people in the way that they feel called to?
Yeah, I think you'll know what your calling is, and just provide great service, and add people to your team, and little by little, it'll grow, and you'll be able to help as many people as possible.
I like that. Just staying mission driven and all these things we talked about is so key. Um, Ultimately, like they'll help us in the end. And I just find that a lot of things we talked about in this interview are so important, so powerful, and just being able to kind of take information in and kind of apply it in a way that we see fit is key. So appreciate you for sharing your story, man. That's really empowering, and just hearing other people's stories can be healing in and of itself. To
Yeah.
know that hey, there's actually some possibility. Um, you know, Adversity is here to overcome, right? And it seems like you've done that. So appreciate you coming on. And is there anything you want to leave with people today?
Be hopeful. Know that your belief can change and your life can change. And be open to that. And seek out mentors if you need to, and take the steps, take those first steps, and little by little, you'll see some huge changes in your life.
Awesome. So if people want to get connected with you, your work, where can they go?
You can reach me on Instagram, Dr. Hilario, Hilario, or my website, ChiroRehabSource.com.
Awesome. Thank you so much for sharing your mission and empowering people today. Uh, it's been awesome.
I appreciate you. Thanks for having me.
Awesome. Thank you.
All right, Anthony.